So thank you, Karen, and Opal and Erin. Hopefully, y'all are okay with doing the recording. And it means you can refer people or use the YouTube too once I get it uploaded. So I'm Margaret Fire-Robin, and I wear a lot of different hats, and this is Coordinated Community Response. For history, for some new folks, we started doing this during COVID and doing it as Family Promise of Bristol and Appalachian Promise to address everything that was going on during COVID for who had housing dollars, who had hotel dollars, who had what. We met every week, then we went to every other week, and then eventually once a month, and we have continued to meet once a month, and we network and try to keep up with each other and try to get programs of interest to both Tennessee and Virginia folks. And sometimes it's having somebody from each state, and sometimes it's programs that apply to both. I'm really pleased with the programs we've had recently. We had Linda Austin, we had Clay Mitchell, and I have not uploaded that one to our YouTube channel yet, from Mountain Mission School. And today we have Opal and Erin, and I've seen their presentations. I think we'll all appreciate what we learn. And then hoping in October, either the 24th or the 31st, because the 31st is Fifth Friday, to have Beth Reinhardt from the Bristol Chamber. Some of y'all here may have participated in focus groups about a year ago on economic mobility. So getting some information back. And at that time, there was potential of getting further, it was planning dollars of getting implementation dollars. So we're hoping that some of that may come through. Don't know yet. Also, we coordinate with Bristol Coalitions. They meet on the second Tuesday. They are doing hybrid meetings. It started out being focused only on Bristol. Virginia. They've been doing a long time. And now they do some Bristol, Tennessee, and Virginia. So I know some of you here go to those meetings and keep up there. So I want to welcome everybody. Our format is we're going to have our program and some discussion, any questions, etc., and then have a little bit of time to network, make any announcements, share anything that we have. So I know several of y'all are here for the first time. We think that's wonderful that you're here. And also we know that schedules are busy. We've never met in person. At this point, we don't ever intend to. We like in person. It's when you network and meet people, etc. But for this, we want to keep it easy and able for people to join, and also do the recording where people can access past recordings and share those. So with that, I did not get complete bios. I guess I could have. I put a little bit on Erin and Opal, and I know in my role with Family Promise, we met on Zoom a while back. They have a reputation that precedes them. That's all good. And they are becoming very well known in the community. Also, they are part of, and some of you may not know about, and I should probably send some information out to the group. We have, and I don't know if y'all plan to touch on it, the Housing Coalition that has begun for Tennessee and Virginia. At some point, it may have subgroups or whatever, but it's pretty awesome to have people focused on the same goal. And right now, Strong Accountable Care Community, Strong ACC, is helping to facilitate that. So Erin has a background with nonprofits and with homelessness and with Salvation Army. And Opal just recently received her doctorate in public health. And I have a master's in community health education, but it's an MED instead of a MPH. So that's after my heart for. And if y'all don't know on here, health education can cover just about everything, because you get into the social determinants of health, and it's you choose. Anyway, so we're very pleased to have you. And with that, I'll turn it over to y'all. And if you need our help in any way, holler. And if anybody online is having trouble hearing or getting the information, you can also, Karen put her information in the chat. Karen's with Family Promise of Bristol, so is Sam Ferguson on here. We're appreciative for what they do. And put it in the chat, and I try to send out the chat. So if you need any of the information in that, if anybody needs contact information for anybody they see on here and can't get it, I've got tons of people's contact information. So anyway, okay, with that, Opal, Erin, go for it.
Okay, I'm going to get our screen pulled up here and then let Erin take it away.
Well, yeah, first and foremost, thanks for having us. We will give maybe a little bit more background on each of us. As was mentioned, I've worked mostly in the human services nonprofit space most of my career. I first came down to this area to be a Milligan College student. I know it's now Milligan University. I just always say Milligan College because that's what it was when I went there. Met my wife there, and I've lived back here in East Tennessee. My wife teaches at Milligan. So we've been back here since 2010. So this is home. We have 3 kids. We live here in Johnson City. And again, most of my career has been in the nonprofit space, and mostly working on housing and homelessness. So that's a little bit of background about me. And Opal, do you want to highlight a few things about you?
Yeah, I moved here about 13 years ago from the Midwest. I've always been in rural areas. And yeah, just kind of fell in love with the area prior to it being very popular to move here. And met my spouse here, and we're both, well, they're affiliated with ETSU, and we have 2 children. And I have done a lot of different things in my lifetime. I've worked heavily in the nonprofit sector, but I've also worked as a clinical nurse for a long time, mostly with individuals that are in the deep recesses of poverty or are and specifically children. And then kind of moved into my doctorate after COVID hit, and I decided that the healthcare system wasn't necessarily the environment that I wanted to spend the rest of my career time in. So, yeah, but with that, I'll let Erin get us started.
Yeah, so we wanted to sort of start by acknowledging that, tomorrow's the 1-year anniversary of Hurricane Helene hitting our region. And I know that impacts all of us to one degree or another. One of the things I've had the opportunity to do, in addition to being able to work alongside Opal this past year on implementing the strategic plan for the city of Johnson City to address homelessness, I've also been very involved with Washington County, Tennessee's long-term recovery group. And so, yeah, just knowing that there's a lot of anniversary and memorial events being planned and executed over the next, 24 to 48 hours. There's just a lot going on. And I think one of the things I've learned is just how kind of interconnected all these pieces are. The work that we've done in homelessness, as Margaret mentioned, is starting to gain traction with folks who care about not homelessness per se, but maybe they care about housing, but they're seeing the connections between the need for workforce housing and the need for affordable housing and the issue of homelessness. And now we have the issue of disasters, layered on top of that. But all this is kind of interconnected in one big stew. They're not separate silos. They are interrelated. So regardless of what your involvement is in the community, if you're a volunteer, if you're a nonprofit leader, if you work in healthcare, if you work in education, like all of this touches on all of this, right? And it's all interrelated. So we definitely wanted to start by sort of acknowledging that this is sort of a heavy weekend for our region because of that anniversary. Yeah, we definitely want to mention that, and we'll touch on that maybe another couple times throughout the presentation. But yeah, that's a little bit about how Opal and I got connected. Is that Opal was working on her doctorate at ETSU, and why don't you kick it off, Opal, with from there?
So I'll get into how that relationship kind of came about, but first of all, I just want to draw our attention to who is experiencing homelessness. And so a lot of this data that you're looking at specifically is for our 8-county region. But this is also indicative of the national trends as well, right? So we are not experiencing something that is an outlier event that is wholly unique to our area. There are certain things that are unique to our area, but we are on trend with the rest of the country. So this is the way that the data is reflected. And I just want to talk about the point in time count, right? That's called the PIT count. It is a great indication of what we call longitudinal trends. So trends over a long period of time, but it doesn't necessarily indicate exactly the number of people throughout an entire year that are experiencing homelessness. And so researchers like myself have been more and more critical of this because we don't exactly have this federal and state support in order to deeply understand, I should say, the quantification of exactly everyone experiencing homelessness. But what we can extract are some of the trends. So you can see the trends in our area are rapidly rising. And they have been since 2017. But the reason why it's only back until 2021 is because of the way that we gather data. And I didn't want to mislead anyone as to how we are experiencing our trends in this area. So historically, when we think of individuals experiencing homelessness, we kind of think about that chronically homeless population, but really that is a very specific subset of folks experiencing chronic homelessness. More and more, we are seeing people that are experiencing homelessness for the first time, which is why why the trends are continuing to rise. So this buffer between what we think of traditionally as those experiencing homelessness and those that Erin mentioned earlier, that we think about those that just need workforce housing or affordable housing or attainable housing, whatever adjective you may want to lead with, that buffer between those two is rapidly dwindling. And in part, it is due to the popularity of our area, but we're seeing a housing crisis nationwide. It is more exacerbated in our area due to a few different elements that are specifically within the Bowen report, and I'll let Erin talk about that a little bit later on. But overall, one of these biggest pieces is that we are experiencing astronomical housing prices with stagnant wages. So that means our families and our older adults on a fixed income are, of course, in a very precarious financial space. So adults experiencing homelessness that are over the age of 65 is anticipated to triple by 2030. And that is a very significant number as a researcher that I find to be very concerning. Our families are often in hiding, specifically within the state of Tennessee, because our state policies aren't exactly supportive for those families that may be precariously housed. So those folks are going to be in hiding because of fear, but also because of, in the state of Tennessee, you can make a pretty strong case for children to be taken away in the event that a family does not have a home. So this is complex because we're seeing this nationwide. My research initially focused on the Johnson City area, but it's also easily extractable to the surrounding areas, right? Because Johnson City is certainly not within a vacuum. So there we go. One of the things I also want to bring to your attention is we oftentimes think of, well, we need to address mental health or we need to address homelessness instead of the housing market. And what I want to say to those folks is, yes, those pieces are critical and they are important. However, I just want to take a moment to remind a lot of people that there are a lot of us that have substance use disorder, and there are a lot of us that have mental health issues and remain housed. So one of the driving factors here is, in fact, the affordability of the housing in your area and the availability of the housing in your area. I've been a part of street medicine teams, which are wonderful, soup kitchens, all of these firsthand services. But again, I do want to stress, if you are expecting to see homelessness reduction, we cannot expect anyone's health to improve. We cannot expect anyone's substance use disorder to improve. We cannot expect anyone's mental health disorder to improve without addressing the housing piece. So for me as a researcher, one of the first things that I saw when I got into this was the need and the desire to address the root cause of the issue, which for me stems from the housing market itself specifically. Housing first practices over and over again have proven that if you provide housing first, the rest of those health pieces may follow, and they can follow. If we do not provide that housing first, you are just kind of lucky if you see improvements on anybody's health, substance use disorder, or mental health issue. So in this data that you see on the right-hand side that's depicted in that column is from a study conducted by the International Housing Coalition, and I believe that came out in 2019. So that is the best and most recent data that we have on that. So just for an example, right? So I used to go into people's houses and educate on diabetes pretty regularly. And instead of being able to talk to the folks that I work with today who are experiencing homelessness, I can't talk to them about their blood sugar levels. I can't talk about insulin, how to insert the needle, any of that when we're not sure exactly where their next meal is going to be coming from in general. So housing first is a big proponent here. My relationship started with this back in 2022 when I conducted the first qualitative study in this area. The important piece that I want to stress here is I did a pretty in-depth SWOT analysis to audit why our social programs in the area. So why are we not getting folks into housing? And I conducted 27 interviews, anywhere from direct service provider to executive director, and also at the local, regional, and federal levels. So I really wanted to have a breadth of understanding. And after I conducted this, it was presented to the Johnson City government, and we kind of formalized our contract. And that allowed me to get into the secondary part of my dissertation, which was the quantitative study. So really quantifying what it was that we are observing within our area that is prohibiting us from getting folks into housing. Simultaneously, I was using that data to conduct community-led meetings, which is how Aaron and I got heavily involved with one another when he was working at the Salvation Army. For me, the greatest parts of research is the opportunity to apply your research out into the field, not for it to live behind university walls in a library somewhere. It was really important to me that while I'm conducting all of this research and observing and learning, we're also creating a plan to address the current issue. So while this was, yes, based in evidence, demonstrated data, it was based in research, it was still culturally specific, which is highly important to our area. It wasn't until 2019 that the US federal government recognized that there was homelessness happening outside of a metro area. Prior to then, it was categorized as an urban phenomena. So there are a lot of pieces in this specific work that are not necessarily going to be replicable within a large metro area. It's intended to be for mid-range cities like those that are in our area and are specific to that. From that strategic planning session, which we had maybe 30 or 40 organizations represented and well over 150 people, that strategic plan was then presented to our commission in workshops in 2024 and 2025, and was intended to be set up for adoption by our city policy. Now, since then, they have decided that that is not the space that they want to continue moving into. And so we haven't walked away from the strategic planning process, but we've decided to harness it and walk through it from a different angle to ensure that the progress that was made is not lost. And we'll talk a little bit more on that a little bit later on.
So Opal's background again has been doing this research in partnership with the city government. She's been a paid city consultant since 2022, 2023. I came on last year, again, during the time that Opal was doing some of this research in Johnson City. I was working at one of the service providers, meeting with her, talking with her. What are you learning from the research? How can we as the service providers be helpful? How can we make sure that services are aligned? But then I left my role at Salvation Army about a year ago, and Opal and the city approached me about coming on as a second consultant to work with Opal And the goal for the past year has been taking the plan that Opal wrote and beginning to implement it. So it was designed as a 3-year strategic plan. Our goal was not to solve homelessness in 3 years. We didn't think that that was realistic or reasonable, but it was really beginning to lay the foundation of where is our community at, what are our needs, and how can we begin to plug some of those gaps. And we'll mention a little bit later some successful pilots that we've been able to do some really important things. But one of the things that we want to stress to you is that, again, the dynamics are changing. Our community is changing. Our region is changing. So whereas this region was older than the rest of the state of Tennessee, and Appalachia is older on average, and while our health outcomes tend to be poorer, and while our employment rates and workforce participation rates lag behind, what we saw over the last decade or so was communities that were really declining. And a lot of our leaders, our elected officials, our economic development folks were saying, we're sort of in this death spiral to where if something doesn't change, like the viability of our communities is going to be in question. Because if we're getting older, if families aren't moving here, if there's not as many job opportunities, like what is our community going to look like? So just imagine that that's the climate. Up until maybe 2017, 2018, I remember being at an economic development conference when I was working at East Tennessee State University, and you had people like Mark Costa from Eastman and people like Alan Levine from Ballard who were sort of lamenting, what is our region going to do? How are we going to sort of jumpstart the economy? And so from that lens, if nobody's moving here, if we're getting older, if everything's sort of on the decline, why would you need to build more housing? There is no need, right? We have plenty of housing because no one's moving here, no one's living here, all those kind of problems. Well, then this little thing happened called COVID. And so what you see on the screen here is whereas our population was sort of flat or in some communities declining, after COVID, we have seen a new pressure come to bear. And that has been because remote work has become so popular. People have seen lower taxes in this part of the area. And because we had more housing supply, all of a sudden, we've seen all those trends that were going this way, all of a sudden jump and spike the opposite direction. So this is one of the big factors that's putting pressure on our housing supply. And this is one of the reasons why we're seeing the diversity, the face of homelessness, if you will, is not just the chronically homeless, the street homeless, but it's different types of subpopulations. It is the seniors that are on a fixed income. It is the families that are working 2 or 3 jobs, but all of a sudden what they're spending on housing is rapidly changing. Their paychecks are not keeping pace with the expenses that their families have. So let's look at some examples of how we have data to prove that. So on this next slide, in addition to investing in our contracts as consultants, the city of Johnson City did a really important investment by doing 2 studies. In 2022, they had the Bowen National Research Corporation did a study, and then they did the same study by the same organization in 2025. So they're being able to see longitudinally how our housing supply is changing. Now, this study was conducted just within the city of Johnson City. So this is not even Washington County, Tennessee, or it's not regional. One helpful tool would be if we could have this kind of study, but having it in other communities as well. But at least this gives us a snapshot of what's going on. So the Bowen National Research Housing Study was conducted in 2022, but I want to show you how in 2025, the second study, how things look. So one thing you'll hear people talking about, and we're going to talk about workforce housing in a little bit, but people are saying we need starter homes if we're going to attract people who want to stay here and work here. If we want to employ nurses and teachers and firefighters and police officers, those people have a place to live. And we want to say, absolutely, that is absolutely true. And the data proves that out. So in the Bowen report, it shows that our greatest need for sale housing, people that are going to purchase a home, is going to be in that 200,000 to 300,000 range. They project that we are, I believe it's 1,800 units short of what we need, or excuse me, 1,686 units short. So yeah, we also need to build cheaper homes than that are in the $130,000 to $200,000 range. And we need some homes that are in the $300,000 plus range. And if you've paid attention to the housing market, you know what's being built is in a lot of this 300,000 plus. But this is where we need housing built for those that want to purchase, is at the price point that's lower than that. And that has to do with wages and what people can afford. But this next part shows the other dynamic and how workforce housing is just one piece to the puzzle. What we need in terms of affordable housing for rental is at the lower price points. And so the Bowen report showed two things. One, 41%, so nearly half, 41% of renter households and 16% of our owners, people that own their home, are cost burdened. That means they're spending more than 30% of their income on housing. But 22%, so nearly half of that 41%, are not just spending 30% of their housing or their income on housing, they're spending over 50% of their income on housing. So we have about more than 1 in 5 people living in Johnson City is spending more than 50% of their income on their housing. So when we think about workforce housing or affordable housing, Opal and I are trying to say we're really talking about two dimensions of the same thing. These are not distinct, separate silos that our economic development folks, our city managers, our elected officials, our employers, our families, our school system should be thinking about. This is all one interrelated problem. And as it relates to homelessness, we have people that have a steady income that is coming in through Social Security benefits, SSI, SSDI, or they have some sort of benefits, but they have no housing they can move into based on that fixed income. And so you can see the huge shortage of units is in these less than $980 a month, or in the price point just above that. And so the Bowen report has given us a tremendous tool to be able to demonstrate to our community, this is the reality of what our housing supply looks like right now. And so while we historically have thought about, well, what are the drivers of homelessness? And people would say, well, it's probably mental health, right? A lot of these people have mental health problems, or it's addiction. These people are probably struggling with addiction. While that may be true for some of our chronically homeless population, one of the biggest drivers of homelessness and one of the biggest challenges in affordable housing is the lack of housing, the lack of housing supply. Just within the city limits of Johnson City, we are 5,500 units short of what we need. And that's just within the city limits of Johnson City. If you expand that out regionally, think about how much we need more housing. And again, we need housing at various price points too. We need rental housing that's affordable. We need starter homes and affordable homes for purchase that are at price points that people can afford. So this is the data that we've been able to bring to bear. And as we're talking about the issue of homelessness, we're taking that issue of homelessness out of that silo and helping people realize the biggest challenge, maybe the biggest challenge facing our region, is this housing issue, because it impacts workforce, it impacts affordable, it impacts homelessness.
And I do want to just take a second to impress upon people that 20% of people that are paying 50% or more of their annual income towards housing, as a researcher, would consider precariously housed and are teetering on the edge of experiencing homelessness. A lot of these folks are simply people that are going to work and the money is just not making the ends meet because of the inflated housing prices. So that's why Erin's saying we've got to think about the housing crisis as more fluid than what we're currently thinking about in these buckets.
And what are those people doing? If they're spending for 50% or more of their money on housing, what are they not able to afford anymore? Are they not getting their prescription meds? Are they having to go to the food pantry to stretch their food budget? Are they having to go and get rental or utility assistance? So these are the type of wraparound social services that maybe we've been meeting needs, but now we have a 20% spike or a 50% spike of the people that are coming into a social service organization saying, I need help with my rent. I need help paying my light bill. I need to supplement my food income. I can't afford gas to get to work. Well, of course they can't, because they're spending more than 50% of their income on their housing. So those pressures are not just going to be coming on our social service nonprofits that provide housing through emergency shelters, all of our food security nonprofits, all of our programs that work with low-income families in any aspect are going to have more pressure coming on them to deliver more and more services, and they're going to need more and more money to deliver these services. But what's the root cause? We're saying we've got to attack and we've got to address this housing issue because it's what's driving this pressure on our low-income families.
So one of the responses has been this Regional Workforce Housing Alliance. This was brought together by 8 individuals who are led by Leighton Harding of Powell Valley National Bank. I just wanted to throw this out there as this work is starting to morph into more of a regional approach is my hope. Not that we're going to just apply the strategic plan arbitrarily, but Aaron and I and this Regional Workforce Housing Alliance have agreed that this needs to not be just done in silo within each of these cities, but we need to understand the housing crisis and approach it from a much more broad area because we recognize that we're all not in a vacuum. So this is one of the pieces that has been brought together by the Strong ACC. They've been the primary coordinator of that. This is a fairly young group. But I am very excited about the people that are contributing and coming to the table about this. In the event that you would like to be participatory in this work, and I will tell you when the next meeting is, you can contact either myself or Aaron and we'll provide you with our email addresses and we'll try to get you connected to the Workforce Housing Alliance so that you can get more information based on that. And I apologize, something happened when I saved this and the formatting went kind of wonky. But I will have Margaret Reed distribute this for everybody. Aaron and I like to leave everyone with kind of a menu as to how you can approach community change. So this is a manual. You can see the table of contents and not the cover, unfortunately, but you can see the manual of different ways that we can approach addressing the housing crisis as a community. You know, a lot of times I feel like people get so overwhelmed by the broad and vastness of the housing crisis and homelessness that they don't even know where to start. So this is a leveraging tool for how we can either as an individual, at your church, small businesses, large corporations, institutions, local governments, how we can each plug in within a way that may be fitting for our personal and professional lives.
Just as an example of that, to talk about one of the successes we've had over the first year of implementing, we recognized a crucial need in Johnson City was that we had an inclement weather sheltering plan, but that plan was the number of beds that were being offered by my former employer, the Salvation Army, which is a great resource that they've been offering for many years, but the need was outweighing the program. And so Opal and I identified a group of partners and on basically no budget. We didn't have money for cots. We utilized our partnership with Emergency Management Department to provide cots. We provided churches that provided and opened up their space, as well as some other nonprofit partners that said, well, we would be willing to open and host, that if the primary overflow cold weather shelter gets full, will become the secondary overflow site. And so that became a really successful model for us in identifying just what Opal said, that we have people in our community that want to help and make an impact on these issues, but a lot of times they don't know where to plug in. So we put this menu together. If you scan that QR code, it'll pull it up on your phone to where you can see the menu and it gives you options. You know, just like when you would go to a restaurant and you have a menu where you wouldn't expect to pay the same amount for an appetizer as you would for the 5-course meal. Addressing these issues is going to cost you something. We want to be clear about that. None of this is going to happen for free, but if we don't do anything, it's also going to cost us and our communities something. So different people are going to have different bandwidths of ways to get involved. Maybe the retired person has 10 hours a week that they could dedicate towards volunteering with an organization versus the working mom that's 35 and has the full-time job and all the things going on may say, well, I could plug into something once a month through my church, but I've got like 1 hour a month. Well, there's going to be different ways that different people can plug in. Different people have different amounts of money. Different people have different assets. Maybe you have a rental property. That would present an opportunity for somebody that owns a rental property to stop Airbnb-ing it and rent it to a low-income family in their community versus another person doesn't have that asset. But maybe they do have time and they'd be willing to be a driver to drive people from the primary cold weather site to the overflow shelter site at an area church. It's going to take all of us giving what we have and piecing these different pieces together to be a part of the solution. And so this menu is just that. It's a beginning point for conversation, for discernment, for our communities to begin to have conversations and say, what is it that we have as far as assets, and what do we see as the challenges, and how can we begin to map those things together? How can we bring the tools and the resources that we have to bear on the issues and the challenges that we're facing?
One of the other pieces that I do want to, I suppose, unofficially, officially announce into this space with so many wonderful partners and stakeholders that are present today is the fact that we will be partnering with East Tennessee State University on applying for the upcoming ARISE grant. The intention behind that is that we will be developing a housing studies and solutions center so that we can invest in housing technology and we can start to look at some of the policies in our area that are prohibiting the development of building in a traditional way and through housing diversity. So the idea is that we're hoping to bring together multiple institutions and multiple partnerships so that we can have a greater impact for this area and really improve the social impact for Appalachia, Central Appalachia in general. Aaron, is there anything I'm missing on that piece?
No, yeah. So as Opal mentioned, we were recently, notified by the city of Johnson City that they weren't going to be extending our contract. And so Opal and I have been working on discussing how are the ways that we can take what we've been doing in Johnson City, but recognizing that this need is not Johnson City specific, it's regional, and begin to make larger connections across the region to have conversations about how do we make this more of a regional approach to addressing this issue. So we're excited about the potential partnerships that we're establishing with some of these institutional partners. And really, it's sort of a call to action at this point. If you or your organization, whether that's your church or your educational institution or your nonprofit that you work at, if you're interested in getting more involved in this work, again, there's ways to plug in, whether that's attending the next Regional Workforce Housing Alliance meeting, or whether that's getting in touch with Opal and I and figuring out, does your community want to do a similar cold weather sheltering program coming up this winter? We want to share the resources and the connections we have so that we as a region can begin strategically addressing these issues more effectively.
And Aaron mentioned this in brief, but the next Regional Workforce Housing Alliance meeting will be October 28th. That is a super easy way to just step into it and get involved in the conversations that are being had and how we're going to keep moving forward in general. So please be aware that October 28th is the next one. You may put it on your calendar. And in the event that you were unable to use the QR code or something funky is happening, obviously the formatting, we are not living in 2038 as the previous slide said. I will have the housing menu shared out with all of you. So Aaron and I love to be in touch with people. This is our contact information. Please feel free to write it down. We're also happy to take questions at this time. This is a really vast and broad topic with a lot of diversity and nuance to it. So I always find that the Q&A sections are usually the most interesting out of the entire presentation.
So, first off, wow, great. Another really good presentation. So thank y'all very much. And I would encourage, if you have comments or observations also, other than questions, that'd be great. So does anybody want to speak up immediately? And if you want to go ahead and speak up, I can't see everybody at one time for hands up or whatever. So just unmute and talk. I'll say a few things, maybe that'll help start off. But first off, yes, thank you for recognizing Helene. We did that yesterday at a meeting also, and even for us here in Bristol, the immediate effects we were fortunate not to have the weather effects, but certainly everybody's impacted personally in some way or another with people they know or whatever. People are definitely impacted. The other thing that I want to recognize is that we've talked a little bit about it, that we don't know yet what the federal changes, the effects that we're going to see. We anticipate, particularly with the cuts in Medicaid, that it will have tremendous effects on people's housing status, as well as their health well-being. So anticipating, but don't even know hardly how to start planning for what we think we're going to see in a relatively short term. And for those of us who work in it, we wonder how much people who are not tuned in have any idea of what effects are coming from. And for Family Promise, we're waiting to learn what kind of funding that is, whether we'll have it, whether we won't. Besides the people that we care about, that we work with being affected, it also affects many people's jobs. So that are us, right? Whether we'll even have jobs or not to be able to help people. So if y'all could just stop sharing, if everybody got it, then we can see more people at one time. That'd be great. So those are a couple of observations. Other people?
Sky asked a question just about the upcoming meeting. It's going to be at the Southwest Virginia Higher Education Center, and we're happy to make the link to the folks who are taking the registrations for that. So if you just want to shoot us an email and say, hey, I want to learn more about the Regional Workforce Housing Alliance, we'll be glad to connect to you.
Right.
We didn't want to give out, we didn't confirm in advance if it was okay to share the registration person's email, so we would rather do that through us. We just didn't want to step on any
That's
toes.
great. And yeah, and I'm part of it too. I wasn't at the first couple of meetings, but it's still continuing to be part of that. Also, just FYI, the Strong ACC has 3 main policy areas that were determined over the past year for state, and we just got into federal. Housing is not on it, but I think it will absolutely be added to the next go around.
I think I see maybe Marguerite that has a hand up here.
You have to unmute, Marguerite. While she's figuring out that, I'll also say and you're still not unmuted, is we know in our Bristol, Tennessee, Virginia community that we have about 25% poverty rate, another 25% of people who are ALICE, asset limited income constrained employed. I think what the Bowen report and what y'all are doing helps to, so we know that, but I think you got it, Marguerite. Wait,
Yeah.
and I'll let you
Yeah.
talk. This and the percentage of the income, et cetera, helps make that real so that we can see better what that means. So I think it's huge. And for me as a locally serving official that has raised tax rates, I'm hoping that we will do work so that by the time we're doing our budget for next year, that we will have a better idea of what the impact's going to be on our citizens and what that means in reality to people. So Marguerite?
Yeah, I'm wondering in that menu, is there details about who is contributing to any of this? What businesses, what collectives?
Good question. Yeah, so one of the other projects we didn't mention, but we'll touch on it briefly. One of the other things Opal's doing through her nonprofit Unity Housing is we developed a service provider survey for all of our partners that have been involved in our strategic planning process to say who's doing what we're going to again then assess those survey answers and then put out a published list of like, here's who's doing food insecurity, here's who's doing shelter, here's who's doing ride sharing, here's who's doing whatever. All of that changes so frequently, it's really difficult to keep up with. It would be great if we could do that at a regional level. Again, like scaling these kinds of things takes funding because these things take time, right? But this is what we think is the capability of trying to institutionalize a center that could be responsible for saying what pieces is Strong ACC already doing, what is United Way already doing, but what are the things that are not being done that are falling through the cracks? And we need to make sure that somebody's doing those things. And getting a more comprehensive list of who's doing what is one of the things that we identified too as a big gap. And so we're trying to, at least in Johnson City, make sure we're talking to all the right people, get an update of who's doing what. And then our plan is to update that every 6 months and push that out to our community. But it would be great to see that happening at a regional level.
And who's not on the, on the list currently, that would be important to start looking into who isn't contributing, who haven't
Right.
we addressed yet,
Right.
to help.
Yeah.
That's
What we found is that as we began talking to churches about the cold weather sheltering issue, we identified that a lot of people want to jump in. They weren't currently doing anything, but once they were more informed, they wanted to jump in and help. They just didn't know the extent of the
Right.
issue. They didn't know there was a need. They
right.
didn't know the opportunity. So I think that's probably true in Bristol and in other communities across our region as well. As people get more informed, oh, I didn't realize instead of Airbnb my house, I could, work with a property management company and try to rent it to a family in need. I didn't realize there were families living out of cars. Now that I know that, I want to use my assets differently. I want to use my time. I want to donate my dollars differently to help be a part of the solution. I think people want to be a part of the solution. They just need to know how.
I'm thinking of the churches and how they supply children's meals on weekends and during the week. That has tripled at least. Who's helping them? I know they go to the grocery stores and they give them discounts or whatever. That seems to be slowing, and I'm sure it has to do with the prices that they're buying the food in the stores to begin with.
Yeah.
And the emergency pantry is crying for food. Where is the lack of food on the chain that would be important for all of these points?
Okay, thank you. Others? And I'll say, we did in Bristol, I'll be talking to y'all. We tried doing a cold weather plan last year that we didn't follow through on, and it was done in an emergency. And there's a big difference between Virginia and Tennessee. But then there's personalities involved too. So anyway, but it's absolute. Also, I'll note when one of our participants is with Sullivan County Health Department, and she made the observation later that heat is actually more dangerous emergency to people's health than the cold is. So, and we know that fortunately this year we didn't have as many high heat days. Whereas our cold, we had a week and a half where it didn't get above freezing.
Right.
But we need it for weather period. So,
And we
how to do that.
We started piloting a cooling center approach this year. Just like any pilot program, it takes a long time to develop and come to the table.
Right.
Our inclement weather sheltering program was so successful because it has been an iterative process that's been slowly developing over the past 3 years. So this was the 3rd year that we implemented it. Luckily, it was present and available when our local shelter, the Salvation Army's building, failed, and we provided around 287 nights of stay for individuals, so we ended up having a much bigger impact, I think, than Erin and I had ever intended.
Green.
So we are actively recruiting more folks to the table to be participatory in that. And we're also trying to extend into the cooling center space as well. Now, I will say, I want to be very honest that we do not collect, and this is really county dependent and is very common nationwide, that we do not collect data on any individual that passes while they're unhoused in a way that is useful, or categorizes that. So we have had inclement weather deaths in our area because of people passing due to being unhoused, but it's not categorized that way. So I don't have a good number to refer to. And I am sure that heat exhaustion, and there are a number of heat related deaths, maybe not this year, because again, it didn't get quite as hot as what it has in the past. But because of changes in the climate, we are seeing those very big highs and lows that are making it more difficult for people to be healthy and be outside. So, yeah.
Right. I'll just say one more thing, and then if we have a few minutes, people can share. With thinking about Helene and the disaster, and I know we had a panel at Strong ACC, and it caused me to think that maybe with disasters, people are understanding that with the short term and long term. The short term is with the disaster. And that just led me to think maybe that could be helpful with some of the conversations that we have that are difficult for people to understand homelessness, but relating it the same way. People need the immediate care and then the longer term. And to look at, I think for the Helene recovery, and just recovery from disasters, I think they talked about 5 to 7 years. So trying to maybe relate that, and maybe people have some opportunity to understand the disaster and then can relate it to homelessness as well, to have a better understanding.
One of the things that I've noticed, again, I've been serving as the volunteer treasurer for Washington County, Tennessee's long-term recovery group. And you have a lot of resource dollars funneling to individuals, to organizations. But one of the first questions is, well, did you register with FEMA? Well, our most vulnerable people may not have a deed that shows that they own the property, or they may have been living in their parents' house, but they don't have a proof, they don't have an actual lease. So sometimes the hoops that people are required to jump through to get all the money that they should be entitled to, it's our most vulnerable people that aren't getting that money. And so there is a need for these sort of unrestricted donations to come to organizations. But we're going to have to think broadly about what disaster response looks like, because there were people who lost their homes as a result of the disaster, but they haven't been able to prove it in the same way that other people have. And as a result, they're not getting the same level of assistance.
Yeah. Or those that are precariously housed anyhow, right? Or maybe inadequately housed. So we actually ended up having a few people in the inclement weather overflow program that were unable to get funding because FEMA deemed it not a correct home, not a proper home, right? So they were living on their property, but maybe it was would have been coded as a shed. So they also didn't receive any kind of funding, or funding that would have been adequate to get them back into housing as well.
Right. Whew. It's a lot. So
it is.
All right. Before we leave, does anybody have any announcements? And I'd really like to go around and do introductions, but I probably don't have time to do that. Anybody have announcements or want to say anything before we wind up? Don't hesitate. And it'd be great for Erin and Opal to know the broad representation that we have with veterans and cities and funding organizations and community action and health care, et cetera. So it's a pretty broad group that's represented.
Gotten some good response in the chat. Thank you. I know Erin is writing down emails, and I just copied and pasted the whole thing just to make sure that we didn't leave out anybody. So,
and that's what I do too. So, all right, Angie Sproles.
I just wanted to say thank you for this information. And Aaron, it's so good to see you again and glad that we were able to reconnect on this.
Yeah.
And I'll be sending both of you an email. This is great information. So thank you for your work.
Thank you so much.
Thanks, Andrew.
And Angie works with Goodwill.
Mhm.
So just,
Wow.
and this is her
Perfect.
first time to be in this meeting, I think. So there may be several people with first times. Also, I'm seeing one of our Family Promise volunteers too, Marguerite, and also Aaron Ward Fur in addition to that. So thank them for being here. All right, well, we will thank you so much, Aaron and Opal. Fabulous information,
Thank you.
and huge to document what those of us serving know a lot of. Some of it we know intuitively, and some of it we do know from our own data, but it helps tremendously to see what everybody has, to see the data and for you to present that. So we appreciate you, and we'll be in touch. I think several of us, including very much myself. So thank you, everybody, and hope to see you next time. Watch your emails. It'll be either the 24th or the 31st, and we'll let you know. So thank you very much.
Thank you all.
You all.
Thank you
Thank
so
you.
much.